Okay, I'm Dr. Robert Stow. I'm the director of the Athletic Training Education Program, and the course that we're looking at is KINS 204, which is Introduction to Athletic Training. Objectives for the course are pretty straightforward. It's an introduction to athletic training. So the idea behind the class is to really introduce the students that are coming to campus into what is athletic training. It's the healthcare profession, getting a chance to really look a little bit deeper into what are the different components, what are some of the different groups, what are some of the different work environment they could be in, as well as part of the course is to give the students some base knowledge that they can start to build their career on early. As a healthcare profession, the biggest challenge that we always have is that the students, when they first start, don't have a lot of experience and knowledge behind what they're going to be doing. So that really limits what they can do. So as part of this course is not only to introduce them to what this profession is, but it's to give them some baseline knowledge. And then once they have this baseline knowledge, when they start into their clinical components of the program, at this time they can actually start to be doing some different things and have some basic skills and knowledge base to build off of when they start getting into the rest of their classes. It's not a real good indicator of what the temperature is down inside by our heart, by our organs, and by our brain, and that kind of stuff. And we want to know what that is, and that's where we look at this core temperature, that we've got this small little range, 99.0 to 99.7 Fahrenheit is what we're looking at for our core temperature. That's a small range to play with. That's homeostasis. Throughout the class, it's a lecture/discussion-based type course. It's not a real big active course. Most of the courses within the program are really activity-based, a lot of hands-on type stuff. In here, we're really looking at trying to tie some of their past experiences that they've been exposed to. Like last week, for example, we did physicals, and that pretty much everybody's had a physical taken. If you played high school sports, going through just hitting different age brackets. As you get older, you have to have a physical done and an update, and just trying to tie that into what are the requirements, what is it that is really need, what is it you want to look at when designing a physical. And so that when you start up again next fall, as they rolled into the program, they're ready to start looking at some of this stuff. They can operate a sling cyclometer. They can start doing some of the different things that we need to think about, in terms of environment. The biggest thing I think we want to get from this course, and I want the students to be able to walk away with, is what is an athletic trainer and how do they fit into the healthcare profession. I think that's probably the biggest concept. A lot of times we get a lot of students that come in and say, hey, I get to hang out on the sideline. Well, there's a lot more to that. As an athletic trainer, we're working with a physically active population, so it's not just the athletes, it's those that are that are active. So it could be your grandmother, it could be your parents, it could be younger kids, it could be the industrial athletes, as we call them, individuals that work on the factory floor. As part of that, and just kind of figuring out how does the athletic trainer fit into all of those different roles. What is their role? What can they do? What can't they do? As part of that. And where does that whole healthcare system kind of end up going, since it's changing on a regular basis.